Alongside new travel rules, as we discussed, the president's promising Americans free, rapid at-home tests through medical insurance and local clinics. The economist Paul Romer has been calling for more testing since the pandemic started. Listen to what he told Jake Tapper back in April of last year when things were getting going.
If we were testing everybody every 14 days at $10 a test, that would come in under $100 billion a year. And I think that would be a good investment for us to make, to just give everyone confidence that we are on top of this pandemic. We can stay on top of it, that there's a plan that will work. It will not require a return to lockdown, and it will prepare us for the next version of a pandemic that comes down the pike.
The professor is with me now. Good to see you, sir. This is another case of where you told us and we didn't really listen. Now, some countries did. Denmark, for example, massive testing in the street. But remind us again why it helps. Even if you don't have a very good tracing mechanism, why does it help if you test?
Yeah. Yep. The most important thing to consider is to look at this number they call R, the reproduction number. If you've got 100,000 people who are infected this week, how many people will be infected next week? If it's less than 100,000, R is less than 1. The numbers are going down from one week to the next. If it's more than 100,000, then we're in this terrible zone of exponential growth. The numbers just escalate very rapidly. Now, the things that influence R, like it's really a measure. If I'm infected, how many people do I infect who are like following on carrying my infection? If there are more people who are vaccinated, that reduces the number I'm likely to infect. But if the protection of that vaccination is wearing off, that tends to increase it again. This is the problem we're facing with the vaccines. It's why the intelligent people who've looked at this have said we've got to have the boosters. Now, the other thing is these new variants spread faster. So that's increasing the number that any one of us is likely to infect. And this is then where testing comes in. If I get a test result and I find I'm infected early in the course of my disease, I can isolate myself and reduce the number of people I infect. I can also go get treatment, which is available now. So the testing is not important for keeping people out. They're already in, it's too late for that. What testing does is it reduces on average the number of people each person infects. Okay. And that'll put us on the path towards having this go away.
Paul, the different countries are doing it different ways. Now, the UK basically handed out free kits on the street, 7 kits at a time. People would send a note saying, you're coming for dinner tomorrow night, please test before you come. And that way. Here, look, I'm not saying you can't get the test in the United States, but it is more cumbersome. They do want insurance details, or there's another whole rigmarole. Does the US basically need to go to a free testing mechanism for all and sundry everywhere?
I think we absolutely have to. And I've been confident for more than a year that we will eventually do the right thing and do this. It's been a slow process, I have to say. The way I describe it is that if we get a region where we start to see infections growing, that R number is bigger than 1, we should carpet bomb that region with these tests. Give them away for free at gas stations, grocery stores, drugstores, drop them from helicopters, I don't care, but get people to take the tests, because if people are curious to know if they're infected, and if they find out they're infected, they will tend to isolate themselves because they don't want to infect the people around them.
Do you think, and this is a sort of a philosophical / capitalist question in a sense, do you think that because the US health system is a provider pay or an insurance pay, that the commercialization of the testing mechanism has got in the way of what should be a healthcare system?
Boy, did you hit the bullseye with that question. I think this is at the core of the problems we're facing in the United States. We've got a system that relies way too much on prices and market signals, and that creates lobbying pressures. There are 2 firms, LabCorp and Quest. that get $100 per test every time you go to a doctor and get tested or go to a hospital. And those companies share that revenue back with the hospitals. I don't know if they share it with the doctors, but they really want to keep that golden goose going. And when they hear me say, let's give away tests for free to everybody, they hate that idea. So it's not just that our system is sort of hard, it's unresponsive. There are very active political pressures and lobbying going on to keep us from doing the smart thing, which is give these tests away for free.
Let's go to the economics. The reality is that we had a tremendous bounce back last year, but that was to be expected. You had a lockdown, you had a recovery and opening up. But we're now in a much more difficult economic environment, in a sense, a sludge, a trudge. High inflation, arguably tightening of interest rates, growth will slow, and this unknown. What should I keep my eye on?
Yeah. So look, we're well below where we were in 2019 in terms of employment. If you look at adults, so forget about young people. So this is over age 24, less than age 55. If you look within adults, the fraction who have a job is about 2% lower than it was just before the pandemic hit. Still, so 2%. Our whole workforce is about 150 million people. 2% means that we're talking about like 3 million people without jobs. So we're a long way away from recovering. And I think this is because our stimulus measures were focused on giving people money they could spend, which has had a predictable effect on prices. We should have been focused on keeping people employed and making sure people had a chance to work. So going forward, I hope we can target any more stimulus we do on things that get people back to work. And if we have to raise interest rates to keep inflation in check, we should still be doing the fiscal measures that are focused on getting people back to work. If we have to, we should subsidize the wages for low-wage workers, make work more attractive, get them back on the job.
Which, of course, is exactly what most of the European countries did as part of their COVID employment policies.
And by the way, if you look at this number of the employment to population ratio for adults, they're doing much better than we have. So we spent a lot more on stimulus, and we haven't done nearly as well because we didn't target it at the right issue.